I'm Joey. I'm 23 years old, and because of Penn, my heart is now healthier than it's ever been. I was born with cardiomyopathy with a mitral valve regurg. I was told right from the start that I wouldn't be able to play rough contact sports, no football, no baseball. They also brought up to me before I got discharged from the hospital that there was a very real possibility that I would have to get a heart transplant later on down the line. I could do somewhat normal things. Everything was fine up until 19 years old. I started having pain, started having palpitations, started getting out of breath. I felt really dizzy and I passed out. My mother called 911, the ambulance came and transferred me over to the University of Penn. I really only had two choices, a heart transplant or this unique trial at Penn. I met my primary doctor, which was Dr. Rami, and he had told me that there was a unique study that I could join that could save my heart, that could make me feel well again, and could make me do most of the activities that I did not and I was not able to do my whole life. So for me, it was a no-brainer. An LVAD stands for left ventricular assistant device. And what this is, it's a heart device used to either be attached to the left or right ventricle of your heart in order to help the heart pump better. Waking up with this device was, a whole new experience from day to day. I had to learn the ins and outs of this device, and I knew that this device was going to take care of me, but I had to take care of it. In February of 2011, preparation time was beginning to explant the LVAD. After the surgery, I spent 2 weeks in the hospital recovering, and Dr. Rami gave me a set date of March 16th to come back for a checkup to see how I was doing. I went in, and my heart was doing great. My ejection fraction, through everything they have done, had gone up significantly. For the first time in my life, I was able to do something that I never thought that I would be able to do. I was able to play baseball, play paintball, play basketball without getting out of breath, and it was an amazing feeling. In essence, it's a whole new me, and without the study drug, amazing doctors and nurses and staff at Penn Medicine, I would not be able to achieve everything that I wanted to achieve. For me, this was not just a victory for my heart, this was a victory for everybody involved. My life is worth Penn Medicine, isn't yours?
Ladies and gentlemen, welcome again to another episode of the Nerd Chronicles. This is your host, proud name over here, Christian Paul. Alright? It's been an honor being with y'all again. You know what I mean? I know the last 4 episodes were probably a little bit wild. Fully understand that. You know what I'm saying? Fully get it. It's insane. Really to the T. But, the ultimate goal right here is to curb stress and try to relieve it for as many as you like to try and get some humor into your day. So, with that, and the reason why I want to literally go forward and just about reducing literally so much to the fact that hypertension can literally wreck anyone's life, right? That's the appetizer. What we're talking about here right now is heart failure, the entree, right? And basically what heart failure basically is basically when the heart muscle actually fails to pump blood as efficiently as it once did. It pumps blood in a normal rhythm and pumps blood in a normal manner. That's basically what heart failure is. It can basically have you prone to cardiac arrest, just like with hypertension. Heart failure, heart disease can literally do the same exact thing. You know what I mean? Unfortunately and tragically, I personally have an aunt on my maternal side of the family who was actually very great friends with my mom, and actually one of her best cousins growing up at the time, who tragically passed away a few years ago from heart failure. At the age of, if I'm not mistaken, at the age of 58. Right, this is a very, very tragic story. It happened literally during the height of COVID, where everyone's literally staying up home, social distancing, literally the whole 9 yards. So that made it like way, literally 10 times worse, adding insult to injury. You know what I'm saying? So I can speak on this personally, not only due to the fact that I work with my dad up in a medical facility, but I also have an aunt that actually suffered from this condition. You know what I'm saying? This is why I do my best. Okay? I really do my best. Alright? Try to get the humor going. Alright, people won't act like it's literally the end of the world. You feel me? So, question you want to ask. Right? Excuse me. So good. Fire. Question I want to ask, right, is this. The symptoms of heart failure, right? So what are the symptoms, you ask? Shortness of breath, right? Fatigue and weakness. You tire out a lot faster than normal. You have swelling in the legs, ankles, and feet, right? The irregular heartbeat, basically we're discussing, your heart muscle pumps blood abnormally, right? Having the reduced ability to exercise basically stemming from the fatigue and weakness, right? Persistent coughing and wheezing with white and pink mucus literally going on all over the place, That could be a big trigger. Abdominal swelling, the chest going a little bit nuts, very abnormal. Drastic weight gain from the bloating, from all the fluid buildup, from like lack of movement, heavy exhaustion, lack of exercise, everything swelling up like crazy. It's like literally like a domino effect, if you will, right? And then you deal with nausea and lack of appetite, not having the energy to eat. You deal with that situation. You deal with difficulty concentrating and focusing due to the fact that you're dealing with so much pain, especially up in your heart right here, right? And then you already know the ordeal of chest pain getting caused by a heart attack. That's a big symptom right there. Now, what are the causes of heart failure, ladies and gentlemen? Coronary artery disease, obviously. Heart attack, which we know, leading to cardiac arrest. Hypertension, right? Faulty heart valves, heart muscle damage, overdoing alcohol use, overdosing, dealing with sleep apnea, smoking the cigs, right? Dealing with these solid flashy drugs, Molly, you know what I mean? Percocet, you feel me? What else we got? Ketamine, maybe, fentanyl, opium, all of the high exhaust that you see up in the fancy clubs, the suburbs, y'all love getting from foreign countries. Insane. And we're gonna talk about this later on in the episode too. All right. Insane. And then we got 420. Smoking weed. Right? 420. Right? Getting yourself stoned to know tomorrow, right? Losing your focus, slowing your heart rate down, right? Myocarditis. Okay. You got another issue with that, Congenital heart defect. Not another cause for heart failure. You feel me? Right? So if we go down to the causes, we got arrhythmias, diabetes, definitely another cause of heart failure. If you OD on diabetes medication, it could be a huge problem with that. Right? No. HIV, AIDS, very serious. You know, it's no joke. It's literally no laughing matter. Right? None. Really none. Protein, iron buildup. Right? Dealing with allergic reactions from medicine. Any illness that basically affects the whole body. That'd be another cause right there. Blood clots in your lungs. You know, it could be any lung disease that could generate blood clots. It could actually trigger heart failure as well. Severe infections can also trigger that, right? Use of certain medications, you know, how I discussed earlier, can trigger that also. Definitely viruses attack the heart. COVID-19. No said. And last but not least, we're talking about obesity. Pillsbury Basket Camp, right? You know, Fat Albert, right? You know, what's the other guy, right? Like the Pudgy Sailor. I forgot his name. I know you got the Marshmallow from Ghostbusters, you know. Homeboy over there, you got the classic Ghostbusters movies, you know, it was like very obese ghost. I forgot his name. Y'all let me know who it is. But him too, man. I know some of y'all who are overweight and obese are probably gonna be very triggered to me when I actually list the cause down. Let me be very, very, very clear. It's not my intent to shame anybody with any weight issues that's actually going on. My concern is actually trying to do my best to actually keep you alive. And if you would like to try and change your life and do anything you can, actually better your life to the best you can, I fully welcome that. I encourage you to try to drop the weight and try to actually get as much of the pounds off as much as you can to try and save your own life for literally the sanity of your own family, right? So they don't have to be mortified or traumatized for you being by you being buried early. You know what I mean? And no, I do want to mean. I'm not saying I'm trying to force you to lose weight. You know, it's your life. You have the right to do whatever you want to do. But if you choose, to move forward to better your life, I'm all for it. I encourage you to do it. You know what I'm saying? So, let's go move forward with the complications, right? Obviously, the complications that we see here, kidney damage, kidney failure, that's a proneness, right? Heart valve problems, heart rhythm problems, liver damage, you know what I'm saying? Big time causes right there. And again, how do we prevent it? As I said in the hypertension video, right? Lay off the cigs, lay off the 420, and please lay off them exotic drugs. You feel me? You feel me? Alright? It'll save your life. You smell better that way. You gotta worry about doing all that death breath coming up, like all up in you, actually like getting all the breath coming by you and all dealing with all that smoking. Smelling nicotine all over your body, all over your hair, all over your breath. It's nasty. It's just reeks of death. You know what I'm saying? It ain't worth it. Definitely not worth it at all. It's not. You know what I'm saying? And also, as I stated earlier, lower your high blood pressure, lower your hypertension, reduce your stress. I will discuss all the details and all the ways to literally reduce your stress in these 4 clips. You may want to check them out. And they got everything literally fully detailed. You know what I mean? So that you'll be able to get back to your happy state. You ain't got to worry about sobbing. Ultimate goal is literally get back to your happy state where you're actually literally pumping iron and going crazy. Or if you want to feel like you're in a Fabio moment, or if you want to try and literally emulate yourself as you're in a hair commercial. You know what I'm saying? With the Tresemme Miles up in here. Yes, girl, yes. And the Earth's Herbal. That's what Pantene say to be your health. You know what I mean? You know, get yourself back in that happy state. Right? That's what I'm basically trying to tell y'all. Reduce your stress. You feel me? Stay as physically active for as long as you can, whether it's like heavy lifting, pumping iron, calisthenics. You know what I mean? Getting yourself moving, intensifying your treatment, literally intensifying your training to the point of hypertrophy. You know what I mean? And also, when it comes to them strawberries right here, I know a lot of people mock me saying I eat like a Marion, whatever it is. Okay? Again, I'm some part of a mental show, but I'm literally here to prove a point. This right here good for you. This right here is literally good for you. Okay? Help save your life. Alright? What help save your life is mainly water, plant-based, nutrient-dense, all the natural sugars that you can literally find. But we do this more often. Please stop at the McDonald's. Please do your best to limit the Taco Bells, McDonald's, and the Burger Kings, Wendy's, White Castle, KFC, Long John Silver's, Arby's, all that deep fried nonsense, that hogwash that's been going up in your system. You trying to get all the grease that's up in your body. It slows all the blood clots. It forms blood clots all in your heart. It actually slows the heart rate down. You know what I mean? It voices the heart rate to literally pump itself faster in a normal way. You don't want that. You really don't. You really don't. You know what I'm saying? It'll save your life in the long run. If you want to continue doing take the fast food route too often, you can unfortunately literally shorten your lifespan, and that's unfortunately not really a good thing. It's always best to literally watch your caloric intake from when you eat, right? Because God forbid you don't. You need to literally maintain a daily caloric intake of about 2,000, 3,000 calories a day if you want to try and at least maintain or lose weight. You know what I'm saying? It's really, really important. Heart failure is literally no joke. It can literally happen to anyone at any given time. Any given time. You feel me? And I had to stress this out because, you know what I mean? You got one life to live and you can't even waste it. You feel me? And if you don't even take heed of the matter that you have, literally quick and soon, nothing else to say. It's my hope, my goal is try to spread a little bit of humor and some craziness and try to give some consistent urgency and try to make sure they go to their doctors if they actually see something wrong. And if you really need to seek medical advice, please, please, please go seek a doctor. All right? Go seek a doctor. Go seek a doctor for actual medical advice, treatment, diagnosis that you definitely need, and dig for further digging if he senses that you got heart failure. And please take it seriously. You feel me? Ladies and gentlemen, we will be digging into the heart failure prediction data set that is posted by a good friend from Kaggle, Larxell, which was updated about 2 years ago around 2020. So it basically gives a quick summary about what the heart failure prediction data set is. And it basically states cardiovascular diseases are the number one cause of death globally, taking an estimated 17.9 million lives each year, which accounts for 31% of all deaths worldwide. Heart failure is a common event caused by CVDs, and this data set contains 12 features can be used to predict mortality by heart failure. Most cardiovascular disease can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity, and harmful use of alcohol using population-wide strategies. People with cardiovascular disease or a high cardiovascular risk, the presence of one or more risk factors such as hypertension, diabetes, hyperlipidemia, or already established disease, need early detection and management, wherein a machine learning model can be of great help. And basically, what they're asking to do, they want a machine learning model that's going to be most efficient for predicting mortality that's caused by heart failure, which the kernel can be featured here. We're just going to basically try to post it up in those appropriate channels here, and you use the data set basically in research. You credit the offices there. And as you can see, based on the video, we have Mr. Chico as well as Mr. German that basically can predict those survivor patients, which we will definitely license it via GitHub. Once we get the data sets done, we will definitely put the citation onto GitHub as well and get that definitely placed, right? So that will be up in there. We will definitely credit them on that. And if we look at the data that's actually shown here, we already know this is clearly a regression problem, right? So the age, they basically talk about the age of the patient on the leftmost side. If you scroll up here, we talk about the anemia, basically decrease of red blood cells or hemoglobin. Boolean, right? So if it's a decrease, 1 is yes, 0 is no, right? Based on what I'm seeing. Creatine, phosphorus, basically the level of CBK enzyme in the blood. Micrograms per liter, coming from 23 to 7861, right? And diabetes, we know if the patient has diabetes, 1 is yes, 0 is no, right? If we scroll in the middle here, right? Ejection fraction percentage of blood leaving the heart, age contraction percentage coming from 14 all the way to 80%. And hypertension, whether or not the patient has hypertension, 1 is basically yes, 0 is basically no, right? If you scroll down up there, we see the platelets in the blood of kiloplatelets basically per milliliter coming from 25.1 kilos to 50 kilo platelets, right? Go all the way down to the last most columns here. Serum creatinine in the blood from half to 9.4. Serum sodium is 113 and 148 milli-equal liters per liter, and the sex is either woman or man. 0 is basically a woman, 1 is basically man. That's basically how the column goes. That's basically what the file is about. So clearly, based on what we are seeing, this is clear-cut regression problem, which we will definitely apply to on Python. We will definitely be doing a couple of models here. We're going to definitely do 2 parts here. The first part that we will definitely focus on is machine learning. That will be in a separate video, which you will definitely see definitely within the weeks to come. And the second will be the deep learning analysis with this data set here as well. That will also be released within the weeks to come. All right, so y'all please expect those data sets to literally be in the coming weeks ahead. You know what I'm saying? Again, this is a huge, serious issue for anybody. You know what I mean? We're going to make sure everything is like fully set so that we will be able to actually present the appropriate data set for you to actually predict the model of mortality, because mortality, unfortunately, is a very, very serious thing. And we do not want anyone to actually experience that type of level of mortality way too soon. You know what I mean? Please, 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 I beg you guys, get your health in order before it's too late. And with that, Christian is signing out. Deuce.